Hello, Dr. Karin Pirc. You're one of the speakers at the International Ayurveda Congress, which is going to be held in Holland between the 10th and the 14th of April. And your subject will be treating 20,000 patients with Panchakarma. And of course, you're very highly qualified to give this talk, as you've been the main supervising doctor of the Ayurvedic treatment called Panchakarma at the Maharishi Ayurveda Clinic in Bad Ems, Germany, for quite a number of years. Could you tell us a little bit about what Panchakarma is and why it's so central to Ayurveda?
So Panchakarma, if we translate it, it is two words. Pancha means just five and karma means like treatments or actions. And this is a very deeply purifying system of different therapeutic measures. And if you wanted to explain this in a very easy way, you would always say that Panchakarma derives three different main steps. So the first step is to loosen up toxins which have been stored in the bodies or residues from metabolic waste which are also inside the body. So that has to loosen from their binding materials inside the cells. So like this, we do that with drinking of different fatty substances, of oiling the body with different massages, all kinds of fat-soluble things. So when this is done, the second step is increasing the metabolism of the body so that it naturally brings all these loosened up toxins to the excretory organs. So like that we do with steam baths or local heating procedures, something like this. So just increasing the metabolism in a very natural way. And the third step is to purify the body, to bring all these toxins out of the body, which is done with purgation or with enemas, something like this. And this is a very important point to understand because these three steps you normally don't have, even not in natural medicine. Because normally you go to a massage, you loosen up the toxins, and then that's it. So then you feel better, and 3, 4, 5 days later you say, well, there it is again, because you haven't sent it out of the body. And that, if you understand this principle, that really nicely explains why the purification we do with Panchakarma is very, very deep.
So your talk at the Congress, which I'm really looking forward to, is about your experiences of treating patients with Panchakarma. And your clinic has treated over 20,000 patients with this therapy. So you've obviously seen the effects of this treatment over and over again over the years. I'd like to ask you, what sort of things do people come along for in the first place? And what is their experience? What results do they actually get?
So first I have explained how this works, and then we have to understand that the body has a constantly healing mechanism, constantly healing and balancing itself. So when we free the body out of these toxins, then the natural healing mechanisms are much, much stronger. And on the first go, of course, if you work as a Panchakarma doctor, everybody gets a diagnosis for about an hour, so you really understand where the problem is, where the imbalances are, what kind of disease is there. And the next step is that we do mainly this purification. And sometimes it's surprising for somebody who doesn't deal with that, how many different diseases you can treat, because you can treat all disorders, for example, of the intestinal tract. You can treat breathing problems like asthma, sinus problems. You can even treat something like dementia. You can treat all kinds of muscular skeletal problems like osteoarthritis, like all these things. And even psychological problems like panic attacks, sleeping problems, so the modern problems we have all these days. And that is, we have to understand that the body has these healing mechanisms. And what we do, we free the body from the blocks, from the hindrances, so it can do this again. And it's really great to see, mostly in a short time, how quick patients recover and feel much, much better.
When you come along next April to give your talk, what will be the main focus? Will you highlight patient testimonials and individual health effects? Or will your main focus be on the scientific research you've been conducting on Panchakarma treatment?
Yes, definitely. Since it's a scientific, since this is a scientific congress, of course we have to find the studies which have been done with Panchakarma. And there are quite a few showing that there is a deep rejuvenation. So you can, with scientific methods, you can find that people doing Panchakarma and having an after treatment, that they really objectively reduce their biological age. You can see a lot of symptoms going down. You can see also, which is surprising, memories getting better. If you do psychological tests, so you don't do any psychological things with the people, but still you see all the improvements in that area. And we also had a little study done in our clinic showing that in a very short time, the reduction of blood pressure in people with high blood pressure during that treatment is between 5 to 10 points, which is a lot with natural methods. So all these things I will talk about. And of course, since I'm a lady, I will also talk about my feelings as a doctor, how rewarding it is to treat these people and to really help them to understand the point. And I will definitely also talk about one angle which we have in our clinic, which we feel is very, very important, is to teach the people about the functions of their body. So we have a lot of lectures, we talk to the people to explain them why is it important to have the main meal at lunch, why is it important to not have a late evening dinner, why is it important to move, why is it important to go to bed in time, all these lifestyle things which are there in Ayurveda since times immemorial, which are basically in all cultures since times immemorial. But they really got lost in the modern times, and that is one of the reasons that we face all these incredible big problems in our health systems.
Yes, one of the wonderful things that I've found about Ayurveda is that it offers a great deal of knowledge and a good amount of advice. I've also found it very self-help orientated so that you can become quite self-sufficient in your own healthcare.
That is a very important point because we, as a doctor, we don't heal patients. Nature is healing and the body is healing itself. So we just help the body to do this. And one point is to get rid of problems or to reduce problems to a very substantial amount. But the next step should be for a doctor to make the person so self-sufficient that they understand how did this disease come along. So like if you work with people, I always laugh with them when they say this. You hear this every week several times. They say, suddenly this disease started and I never had it before. And then I always laugh with them and I say, yes, but no disease starts just by itself. You had to do many, many mistakes for many, many years until you came to that point that your body couldn't cope with it anymore and you got the disease. And then we have to teach them which steps did lead to the disease. Because if we don't do that, that's cruel. Then we send them home. Okay, they can come back next year again, but they will have the same problem again. So we have to teach them what not to do in the future and what to do in the future, that this very specific health problem doesn't show up anymore.
So thank you very much, Karin, for sharing this with us. And I'm really looking forward to your talk next April. It sounds like it's going to be really interesting.
Thank you.